Good day everyone, we are from Group 2. Today we will present about the application of statistics in healthcare, monitor health conditions during COVID-19 outbreak. The team member includes Zhen Yuan, Muhammad Ammar bin Nasharudin, Muhammad Zuhdi bin Muhammad Zuki, Kean Han, and Lim Qing Jun. According to Macroscala 2022, COVID-19 is a highly infectious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, that has caused a pandemic of respiratory illness. Now, I'll talk about the rise of COVID-19 pandemic. A cluster of patients presented with pneumonia of unknown etiology in one city of China was reported to the Chinese Center of Disease Control (CDC) on 31st December 2019. According to Mohan BS, the infection was originated in Huanan Seafood and Animal Market in Wuhan City, and it provided some link in an animal to human transmission through the sale of seafood and live animals. According to WebMD 2021, there have been numerous investigations to determine the origin of SARS-CoV-2, but none has been conclusive. The coronavirus behind Middle East Respiratory Syndrome MERS and Severe Acute Respiratory Syndrome SARS developed from bats. Currently, there are two hypotheses to its origins. The first hypothesis is the exposure to an infected animal, and the second hypothesis is man-made in a laboratory. There is not enough evidence to support either argument. According to World Health Organization 2020, the COVID-19 pandemic has led to a dramatic loss of human life worldwide and present an unprecedented challenge to public health, food system, and the world of work. Tens of millions of people are at risk of falling into extreme poverty. Border closures, trade restrictions, and confinement measures have been preventing people from accessing markets.
Our situation is new drugs that can relieve COVID-19 symptoms by increasing blood oxygen level and decreasing high body temperature has been launched. In order to test the effectiveness of the drugs, scientists decided to conduct a research on all the positive patients in Hospital X. After collecting data of all patients, the scientists select 50 adults from all positive patients as a sample for their studies. How we are going to use the descriptive and inferential statistic. Descriptive statistic based on 50 COVID-19 positive patients will be used to obtain the distribution of blood oxygen level and body temperature. Further analysis using inferential statistic may be applied in order to study the effect of new drugs on all adult patients after consuming it.
Based on the situation given, the population of the study is all the positive COVID-19 patients in Hospital X. Therefore, there are two parameters to be obtained in this study. The first one is the average increase in blood oxygen level, represented by the symbol mu blood oxygen level, and the second one, the average decrease in body temperature, mu temperature, of all positive COVID-19 patients in Hospital X after consuming the drug. The increase in blood oxygen level can be calculated by using the blood oxygen level after consuming the drug, subtract the initial blood oxygen level. Same goes to the decrease in body temperature. Use the body temperature after consuming the drug and subtract the initial body temperature. The sample of the study is the 50 COVID-19 adult patients who are selected from the population. There are two statistics to be obtained in this study, which are the average increase in blood oxygen level, represented by the symbol X bar blood oxygen level, and the average decrease in body temperature, represented by symbol X bar body temperature, of the sample of 50 COVID-19 adult patients in Hospital X after consuming the drug.
Data collection. In our study, we use primary data as a primary resource to help us to collect information from the respondent. For the study we are conducting, we choose primary data because first is it more accurate and convenient to collect information about the targeted respondent. Second is primary data can provide us fresh information about our study. And lastly is we can develop our own data analysis method that is suitable for our study. For population in our study is the entire COVID-19 positive patient in hospital X, and for the sample of the study is 50 selected COVID-19 patient in hospital X.
Now, I'm going to describe to you about questionnaire. Questionnaire is a set of questions that purposely used to obtain any related information for a conducted study. However, we do admit that questionnaire got several disadvantages. For example, not suitable for hard questions. For this one, we include simple and understandable questions to be answered. To overcome low response rate, we consistently blasting the questionnaire through various online platforms, and to avoid time consuming, we include only few crucial questions to obtain crucial information. Also, in the questionnaire, we include some variables with various types of scale of measurement to be asked for the respondent, such as age ratio, state nominal, gender nominal, income group nominal, temperature interval, and lastly, blood oxygen level, which is ratio. And as you can see, this is how we construct the question in the questionnaire. For the second part of the questionnaire, we also ask some questions to be answered by the respondent. And as you can see, for this question in this part, we include two scale of measurement when it comes to answer option. And those scale of measurement are nominal and also ordinal.